Miss Etta Monroe is a 75-year-old woman who lives alone. She's in the hospital because her cat tripped her in the kitchen, which caused her to fall and break her hip. She has just received a hip replacement and is being taught how to safely transfer from supine to sitting, sitting to standing, and standing to a wheelchair. She will be reminded how safely to maintain her hip precautions. Because her hip was cemented, she is weight bearing as tolerated on that leg, but she must avoid hip flexion past 90, adduction, and internal rotation of the right hip. Before the transfer, the SPTA should always wash hands upon entering the room, introduce themselves to the patient, explain the hip precautions, which is the hip flexion past 90, adduction, and internal rotation of that hip, and set up the wheelchair carefully and safely. When setting up the wheelchair, check to ensure that the brakes are locked. The wheelchair will be placed to the patient's left side because we always transfer from standing at the bed to the wheelchair with the uninvolved side. Because she is weight bearing as tolerated, the right knee needs to be guarded to prevent buckling of the knee.
Hello, Miss Monroe. How are you today?
I'm doing well. How are you?
Awesome. I'm Dustin. I'm a student PTA. I'm here to get you out of bed today. Is that going to be all right?
Yes, sir.
Okay. So first thing I need to do is I need to put this gait belt on for your safety and mine. Do you have any problems with, I'd like for you to bend your left knee if you can. And then I want you to try to bridge. So I want you to try to lift your bottom off the bed without flexing this hip at all. So we're trying to maintain our hip precautions. Do you know what they are?
I think you said something about flexing the leg.
Okay. So we don't want to flex your hip. So we don't want to bring your hip up like this. We don't want to bring it up past 90 degrees. So that would be about right here. We don't want to turn our foot in. We don't want to bring our leg too far this way past the midline. You want to keep it nice and straight like you have it right now.
Okay.
Okay. So again, let's try just pushing up with this leg here through our heel, and we're going to try to lift our bottom off the bed. Okay. How's that?
Okay.
Do you have any incisions here or anything I need to know about? Just let me know if that's comfortable. This needs to be a little pretty tight. And so when you go to sit up, it's probably going to be a little loose on us, so we'll have to tighten it.
In order to maintain proper precautions, we will prevent doing a log roll to get patient from sitting bedside. Once the patient is closer to the right side of the bed, we will have them slowly begin to prop themselves up on their elbows while maintaining precautions. The patient will slowly move their right leg toward the edge of the bed with help of the therapist. She will then bring the left leg to meet the right leg. Then she will walk her hands to the left. Repeat this process until the patient is sitting at the edge of the bed, being careful not to break her hip precautions. Have the patient scoot so that her feet are on the floor to begin the transfer. The patient has a Foley catheter and an IV, so it is important that all lines are safely managed during the transfer and transport. The catheter should stay below the patient's bladder before and after transfer and can be placed on the patient's gait belt during transfer.
So to get out of bed, to maintain our hip precautions, I want you to try to get in that same position we had where we had our knee bent here. I want you to bend your knee, and I want you to try to use your arms to push up. So push up on your elbows. Good. Now I want you to do is just try to slide your leg just like this. I'll help you if you need it. Okay. There you go. And let's see if we can scoot in bed a little bit. I'll help you if you need it. Slightly. So we're going to go ahead and get to the chair from your left side. And what I want you to do is I want you to help me as much as possible. Now, you can put as much weight as you want on this leg as tolerated, correct?
Okay.
So, what we're going to do, we're going to lean forward just slightly, but you don't want to be too, aggressive with it.
Okay.
So, I'll help you with this leg. I want you just to kind of push, and stand up, pivot, reach back for the wheelchair. Kick that right leg out.
Okay.
Good. Is that comfortable? Okay. Very good. Very good.
To get the patient back into bed, we will put the wheelchair so the patient's left side is next to the bed. You will block the right knee as you stand the patient. The patient will pivot toward their left side onto the edge of the bed. Have the patient scoot back onto the bed one hip at a time. The therapist will help the patient bring the right leg onto the bed, then the left leg. The patient will walk their hands to the right, bring their right leg toward the middle of the bed, and follow with their left leg, and then follow with their arms. Repeat this process until the patient is in the center of the bed. Have the patient slowly lower themselves into supine. Remove the gait belt with the patient in supine. Be sure that the patient is comfortable with pillows and blankets. Return bed rails to the upright position with one remaining down. If there is a bedside table, place it over the patient's bed with the phone and call button on the table within the patient's reach.
All right, we're going to get back to bed now, Miss Monroe. So I'm going to take the footrest off first for you.
Okay.
I'm just going to stick this right here for a second.
Okay.
So remember, just kick that leg out for me. And we're going to stand and pivot again, okay? Okay. Forward, but not too forward. Kick that leg out. Push up. And we'll pivot. Okay. Yourself down nice and slow. Kick that leg out. Okay. Comfortable like this, or do you want to situate yourself more in the bed?
I just that's it.
We'll take the gate belt from you now. Unless you want to keep it on.
Nah, you can keep it. Somebody else might need it.
So, lift up, good. Alright, anything else I can get for you?
No, I think that's it. Thank you.
Would you like me to lift the bed up at all?
No.